Hi, Dr. Kevin Zorn, Director and Founder of BPH Canada. Today we're going to talk about the UroCuff test. We're the first in Canada to offer this diagnostic tool to our patients. So let's start by what we standardly do. It's called a UroFlow study, in which a patient just urinates into a specialized toilet. And what we're going to see are two curves. One is the volume over time of how much urine in milliliters are being expulsed into the toilet. And then the second graph on the above gives us a rendering of the flow. Normally our urinary flow should be at least 10 or 15 milliliters per second. In this case, as someone has a very protracted, slow flow, so rather than a bell-shaped curve, a flattened curve, and this is suggestive that there's some degree of obstruction or a low flow state with a very weak bladder. So then begs the question, when we deal with BPH, well, what about the bladder? Let's talk about bladder health. So to get flow, it's a very simple principle. We need pressure, and that's the bladder. It does two functions: to fill and be the most compliant muscle in the whole body. So it can fill usually between 400 and 500 milliliters of urine with a very low pressure. That's filling phase. And then there's the contraction phase, in which it generates at least 100 centimeters of water to pressure and push out that urine to completion, but through a passage where, here's our prostate, may cause more resistance. So flow is pressure over resistance. And when we see curves like we saw here, well, is it the bladder that's weak and not generating pressure? Or does the patient have an enlarged prostate? Well, conventionally we'll do what's called a urodynamic study, in which tubes and wires are placed inside the urethra, inside the rectum, and it's quite invasive. Well, what does the UroCuff test do? Well, it's an external small device, disposable. The patient, rather than urinating freely into the toilet, will urinate through this small suction cup, and as urine is passed through the inner chamber, it's going to compress the stream of flow with pressure 3 times per second. So it's doing these small compressions, almost like a blood pressure cuff would. So the patient has no pain, has no sensation except for they're urinating through the special chamber, and we get these printout reports. It's going to measure the flow, the volume, and have an algorithm of whether the patient is unobstructed and generating low pressures. So over here is our pressure in centimeters of water. Or are they compensating by generating more pressure to keep their flow? That's usually the first part of BPH. Patients won't even notice a difference. But internally, the bladder is suffering. It's having to contract harder to generate the same pressure. And then we get into the obstructed phase, where the slow flow, very high pressures, and this is probably the last phase we can do something, and we should do something, be it with medications or surgery. We don't want to get here where there's a low flow and low pressure, because once that happens, we really don't have much in terms of generating pressure of the bladder. It's a burnt out bladder. We don't want to get there. So this is an example of a gentleman that came in. He's been on medications for several years, very slow flow, and there we go. Look at that curve. The graphic demonstrates here he's generating 200 centimeters of pressure for his bladder to get a flow of 7. So clearly this is a gentleman with a slow flow, but the bladder's working twice as hard just to maintain that emptying. So we discussed with him different treatments, and we're moving into a surgical solution based on these findings. So there we have it. This is the UroCuff, the first place in Canada that we're going to be offering this to our patients. Give us much more detail of not just what's happening in terms of the flow, but in terms of the bladder function. And we want to protect the bladder, because once we burn that out, unfortunately, there's not much can be done. So earlier diagnosis, earlier treatment leads to better outcomes.